How does advanced imaging help define lymphoma spread? Imagine trying to understand the full picture of how lymphoma has moved through the body. Advanced imaging techniques are like detailed maps that help doctors see exactly where the disease is and how far it has spread. These tools are essential for making accurate diagnoses, deciding on the best treatment plan, and keeping track of how well treatment is working. They give a clear picture of the affected areas, including lymph nodes and organs, by providing both detailed images of anatomy and information about how active the disease is. One of the main ways imaging helps is through staging the disease. Using scans like computed tomography and positron emission tomography combined with computed tomography, doctors can find enlarged lymph nodes and see if organs such as the liver, spleen, or bone marrow are involved. The PET cohort scan is especially helpful because it shows not just the size of lymph nodes, but also their activity levels. Cancer cells tend to use more glucose, so these scans highlight areas with high metabolic activity, even if the lymph nodes look normal in size. This helps identify hidden disease sites that might be missed with other methods. Functional and metabolic assessments are another key benefit. PET scans use radioactive tracers to detect areas where lymphoma cells are actively consuming glucose. This information helps distinguish between scar tissue and active cancer, especially after treatment. It can also reveal early signs of relapse before symptoms appear, allowing for quicker intervention. Imaging also guides biopsies, which are necessary for confirming a diagnosis. By pinpointing suspicious lymph nodes or masses, advanced imaging ensures that tissue samples are taken from the most relevant spots. This precise targeting improves the accuracy of diagnosis and helps determine the exact type of lymphoma. Monitoring how the disease responds to treatment is another critical role of advanced imaging. Repeated scans, especially PET cohort, can show whether the lymphoma is shrinking or becoming less active. They help detect residual disease or early signs of recurrence, so doctors can adjust treatments if needed and avoid unnecessary therapies. For lymphoma that affects the central nervous system, magnetic resonance imaging with contrast is the preferred choice. It provides detailed images of the brain and spinal cord, helping differentiate lymphoma from other brain lesions. Sometimes, metabolic imaging techniques like PET or single photon emission computed tomography are used to get a fuller picture of disease spread in the nervous system. Finally, accurate imaging helps prevent unnecessary treatments. By clearly defining the extent of lymphoma, doctors can tailor therapies to the individual, potentially reducing exposure to harsh treatments like radiation when they are not needed. This careful approach aims to balance effective disease control with minimizing side effects. In summary, advanced imaging methods like PET cohort, computed tomography, magnetic resonance imaging, and ultrasound are vital tools that help define how lymphoma spreads. They provide detailed anatomical and functional information, guiding diagnosis, staging, treatment planning, and ongoing monitoring. Always remember, for personalized advice and treatment options, it is important to consult healthcare professionals who can interpret these images in the context of each individual's unique situation.